I have the first motion. Now, I don't have anything in here. Okay. Moved by Councillor Mackay, seconded by Reeve Miller. Be it resolved that the Corporate Services Committee of the Township of Whitewater Region recommends that Council ratify the following standing committee appointments by Mayor Johnson. Mayor Johnson, do you have... So there is no change, so do we need...
I interviewed everybody in this room, and only one councillor wanted to change.
With regards to the standing committees?
Yep. The standing committees we're doing right now?
Yep. Your mic.
I asked everybody if they wanted to continue or change, and only one councillor wanted to change, so I decided to go with our standing committees as they are.
As they are. Okay. Is there a list for me, or do we have to pass this if it's not changing? Does the standing committee not stay the same?
That would be my recommendation, that it's not necessary if there aren't changes, but I guess there's discussion to be had.
Okay, Councillor McLaughlin?
I want some change. I've sat on this committee for over 8 years. I do know waste. I don't know any of the other committees, and I feel that if you don't have a chance to try or become part of chairing a different committee, then you're not really gaining much knowledge. So I would like to see them change. I've mentioned this before. I'd like to see like Adams and Brumley, and I'm sure if maybe the CAO could check this for me, but I think every year they change their committees. They rotate them from one committee. 1 year you may be chair of, say, corporate services. The next year you may be protective services. So, and somebody else would take that chair. That's just, and I think it's good. And my reasoning for it is so that you become more knowledgeable of the operations and how the departments work when you're the chair.
Any other discussion? So there's no recommendation. Recommendation is to stay the same?
That can be, if the mover and seconder agree, that can be withdrawn.
Do the mover and seconder agree? That would be Reeve Miller and Councillor Mackay. Reeve Miller?
Stroke it gently.
I'd just like clarification. Is this not the mayor's decision?
According to our procedural bylaw, the mayor makes the appointments, but they must be ratified by all of council.
By all unanimously?
No, a passed vote.
A passed vote.
Yep.
And one further question for Councillor McLaughlin. You say you've been in waste management for 8 years. So we past councils that you were on never changed these either? Just curiosity here.
On past council, we changed some of them. Some chairs were changed. I can remember them changing chair for roads, chair for public works and fire. They were changed, and that was during while you sat, like during the duration, I guess, was over the 4-year term, I guess is the proper word. They were changed. They'd been changed before. It's something like I've sat on them. Like I say, I've sat here for 13 years. The first term, I was chair of nothing. They had their chairs sat. Then they changed it. Then I became a chair of the rec. And then after that was chair of waste management, which I've sat on ever since. So I personally, I certainly know waste. There's no doubt about that. I don't know much about fire, I don't know much about roads,
Yeah.
but I certainly know waste.
Okay, on my opinion here, like 5 out of 7 of us are brand new. We just got our feet wet with what we're doing. I know the consensus up at county council too was the same thing. A lot of us, quite a few of us were brand new, and the consensus was to leave it alone and let's have a little more time on our current chairs. That's my opinion, and for that reason, I don't think I want to withdraw the mayor's recommendation this time. That may differ next year, Darrell, in my opinion.
So the motion is to recommend that council I see Councillor McLaughlin, just one moment. The motion is to ratify the following standing committee appointments. However, due to the fact that there are no changes, the question is Councillor Mackay is satisfied to withdraw the motion? Are you satisfied to withdraw the motion? As there are no changes, the original appointments will stand. If not, then he's just going to make the same recommendations. We have to ratify the same motion. It doesn't really, a motion is redundant at this point, because there is no further recommendations to any changes. I'm not sure why it was here if there is no changes.
So you're saying if I withdraw the motion?
Then I just don't have to
Then you
vote on it.
Okay, then I'll withdraw the motion.
Okay, so the motion has
I
been
see now.
withdrawn.
Sorry about that.
Mayor Johnson.
That would be my fault. I hadn't properly discussed with the CAO that we weren't making changes.
Councillor McLaughlin.
There's not much bother now because it's already been withdrawn.
Okay, the next item on the list is the draft strategic plan update, final review. CAO Christine.
Okay, I'm just going to put it up on the screen. So this is what we talked about when we last met. And I know that I did get comments back from Councillor Jackson and from Mayor Johnson about some things you'd like to change. And I'd prefer not to do it on the fly, but I have a paper copy. So if we could go through page by page, and if you can give me the changes you want, and then I'll make them and bring this forward to the January 20th council meeting to be passed. And then it stands as a guide for budget, and we'll be ready for our public presentations of the updated strategic plan. So, we made a change here in the mission statement. Foster an atmosphere for the encouragement. I think that was Councillor Olmsted's suggestion to put that in there. So is everybody happy with this page?
So just so I don't have to turn around every time?
Yeah.
Is what you've made changes on, is it in the presentation that we have?
Yeah, what you
As
have
well?
is the same as what's behind you.
Okay, thank you. Saves me turning around.
Yeah, in a mirror. Okay, so, and then the SWOT analysis, and I know there were, I believe, Councillor Jackson, you'd asked for some of these to be prioritized. All of this had always just been random, but I'm happy to prioritize it if you wish. So we talked about the strengths, we changed, we added in the location and a number of other tweaks. I could go back through my notes and find them all, but anyway, is there any change anyone wants to make to this page? Shall I just continue if I don't hear anything? Okay. And strengths, page 2.
So I guess the question on strengths and weaknesses sort of thing is, can there be a strength and a weakness in the same thing? Like landfill capacity, and then the landfill capacity, I believe, is in
Yeah, and we touched on that last time round, and when we were having municipal affairs lead us through this at the very beginning a few years ago, it's very common for, some things could be both a strength and a weakness. because there's different aspects of the same thing. That, waterfront in one way might be a strength. Waterfront, when you've got a problem like Muskrat Lake, could be something completely different. So, I hope that answers your question.
Yep. The one thing with the rich history Champlain legacy, not everybody, would know that it's Samuel de Champlain, and my suggestion was that we just clarify what we're talking about, because as kids get, as we all get older, and the kids, whether or not they learn that in school or not, they're not going to know what that's all about, that the astrolabe was found here, and hopefully they get taught that, but without that, they won't know.
Okay, I'll make that change. Anything else on this page? Weaknesses, page 1 and page 2. We talked about adding in the multi-res. Very interesting after all we've heard about seniors this morning, or this afternoon rather. The youth out migration, I wanted to make one point. Back when I was chatting, I just didn't want to take up too much of your time. I had a really interesting conversation yesterday with a guy named Dan Taylor, who's the former economic development officer in Prince Edward County. And I think a lot of you will probably know that around the Picton area, they made great strides with the wine trail and local farmers now supplying restaurants and packaging, bus tours of the wineries, etc. And Dan was telling me that what he's noticing now with the millennials, with the people who are Kent's daughter's age, is that unlike the baby boomers who, like I moved here for a job, this group of people in their 20s and early 30s, they move to an area they want to live in, and then they find work or create their own job. So it's a whole different shift from when we grew up, the way young folks in the workforce are thinking now. Because we talked about youth out migration and youth leaving. Well, we have a lot to market to young people. Move here and find a job, or make your own job. So, is anything anybody wants to change on this page?
I'm just wondering if we can address the presentation by Mike Nolan. I noticed that there are 3 Renfrew County employees here, and just to facilitate them, because this agenda for the corporate services is probably going to last, who knows, could last an hour. So I'm wondering if we can just pause here at page 72 that I have here and jump to their presentation with Kathy being. Does anybody have any objection to that? Councillor McLaughlin?
I think I've seen Joe Genoa here as well.
They've gone for coffee.
Okay. Maybe when they come back, if they could do their presentation as well, because I think it is going, much like what you've said, it's going to last quite a while.
Yes.
When we resume, the one thing I would like to go back to item 1, if we could. I realize, and I wasn't aware, that also was the board appointments as well. In that, and I would like to, I have a few things I would like to say, if that would be, if I'd be able to do that.
Sure. Okay, so Kathy, do you want to come ahead? I'll switch seats.
That's your mic.
Okay, thank you, Councillor Jackson. At this time, I would like to introduce Mike Nolan. He is the emergency, I had it down here, emergency paramedic services. Very good. And yeah, so I'd like you to welcome you and look forward to your presentation.
Great. Thank you, Madam Chair, Mr. Mayor, and Mr. Reeve. It's my pleasure to be here with you today. As requested by this committee and your CAO, happy to provide an update in terms of where we're at in terms of our ability to serve your community, talk a bit about some of the things that have changed, and to state up front, my apologies for any of that was a surprise, but we'll provide you a bit of background and then hopefully be able to talk about the future and how we can continue to work together to best serve the residents of Whitewater, but remembering, of course, that I have to also consider how it affects the rest of the balance of the municipalities within the County of Renfrew. And with me, I have Deputy Chief Michelle Rouet and Deputy Chief Brian Leahy. So we are the senior management team for the County of Renfrew, and just want to make sure that you had a one-stop shop here in case there are any questions that are more appropriately answered by these gentlemen. So Brian's responsible for the operations of the County of Renfrew Paramedic Service, and Michelle, all matters related to quality assurance, statistics that I'll be providing you today, as well as issues that are logistical in nature. We have regulatory compliance requirements with the province that between the three of us, we deal with on a day-to-day basis. I tend to be sort of outward-looking, dealing with political matters, the province, funding agencies, and so on. Brian's responsibility is a day-to-day, and Michelle's to be looking sort of month-to-month, year-to-year, and keeping us on track, so to speak, related to the services that we provide. So happy to stop at any point in the presentation and answer questions, or we can leave it to the end at your discretion, Madam Chair.
Very well, thank you.
Very good. All right, so just a really quick summary. I have given a similar presentation in the past when we had different members sitting around the table, so my apologies to some of you that would have heard this, portions of this in the past. But yeah, you know that the County of Renfrew is about 7,600 square kilometers, going from Armprior to Deux-Rivières, and then of course out to just shy of Whitney beyond Barry's Bay. The paramedic service is a little bit different because the provincial legislation obligates that no matter where you are in the province of Ontario, the closest paramedic unit responds. So a couple of things are different about that. We don't work on a static deployment model. So just because there's an ambulance base in Eganville, for example, that you can assume that there's a paramedic at that base station at any point during the day. We often think about with the fire service, how far are you from the fire hall is how long it takes people to get to you. Because we have a dynamic deployment model, we could be anywhere, anytime, and we also are responsible for 80% of Algonquin Park, all points of the ZEC from Desuisha into Quebec, as well as any of the equidistant points between our base station and our neighbors. So an example of that would be in the winter months, the equidistant point between Huntsville and Barry's Bay becomes our primary response area. And if Muskoka happens to be on a call out of Huntsville, for example, then we may in fact go all the way across if we are the closest available unit to that emergency. So it changes the dynamic slightly in terms of the way that we utilize our resources, as well as the way that I'd like you to think about how we operationalize, because just because you live close to a base doesn't obligate or ensure a level of service as it relates to that. So what I've done in this slide is illustrate what 15 minutes at the radius of each of the discs roughly denotes. It's an illustration in drive time. So if you look, for example, maybe Eganville's the easiest one in the center of the chart. You can see that in Eganville, manually? Okay. Well, you see the red one in the middle. I'll go that manual. The one, yeah. No, that's okay. You know where Eganville is. But you can see from a population density perspective that having a base station there would theoretically be able to cover that population to the southwest of Cobden, Eganville, and then almost touching into the Golden Lake area. That being said, this represents 7 units that are all at base at one time. We do in excess of 22,000 calls per year, so very rarely does our map and our staffing pattern actually look like this, apart from those first minutes of the day where the paramedics start and stop in terms of pick up their ambulance and go from there. An example of that was Michelle and I were at a meeting headed to a meeting with the Lynn this morning. It so happened there was a motor vehicle collision in front of us at 4:16, 4:17. We have an obligation to respond. We become part of the Ottawa catchment area in that response. So when you have 7 units available this is what our night staffing is. So after 8 o'clock at night, the staffing in the county goes down to 7 available units. During the daytime, it's different in that we have the 7 available units plus 3. So currently we start a 2nd unit at the Eganville base, a 2nd unit at Pembroke, and a 2nd unit at Renfrew. This is just talking about ambulances. We don't allow 2 ambulances to be in the same place at the same time because we're trying to always cover as much of the county in our response areas as we can. So in doing that, they get kicked out the door. And our first and priority place in the entire county for that additional resource to go is to Cobden. And that's an ambulance, so you often see it by the flag on the highway at your tourist information center. So the reason they're sitting there is because either there's nobody in Renfrew and no one in Pembroke, so they're in the equidistant point, or they're an additional resource and you have someone covering Pembroke and you have someone covering Renfrew. So those that becomes our what we call Killaloe, Cobden, and Calabogie. So those 3 additional units get pushed out to Cobden, so you have a mobile unit in Cobden in place at a higher priority than anywhere else in the county. And then our 2nd location then becomes Calabogie, and our 3rd becomes Killaloe, all based upon a predictability matrix that we've identified the reliability, so if you use statistical odds ratios, of where that next call is going to come from based upon frequency and importance of the call data that we receive from dispatch. So I'll keep going for you. Another way that we look at the county from a 3-dimensional perspective is look at how we empirically stack our response times within the county. And this graphic is specific to responses to persons over the age of 65 in an emergency configuration within the county. So you'd see some, predictability. So this isn't this isn't the longest response times. This is every minute and every second of every response time per geographic square kilometer within the county of Renfrew. So you can see our challenge when we have 10 ambulances on days and 7 on nights, and we look at what our demand patterns are, hour by hour, day by day, month by month. How we use those resources needs to be rationalized very carefully so that we can have the best response possible for the most likely place the next call is going to come from. So there is a bit of a crapshoot, frankly, that we all end up doing as it relates to where you're going to put your resource in relation to where's your most likely next call going to come from. The province requires us to report at the 90th percentile, which means every 9 times out of 10 have we been able to achieve X amount of performance within the county. So we know that 10 times out of 10, there's a relative impossibility for us to always be able to provide the same level of service everywhere in the county. You can imagine Head Clare Mariah, or in La Paz, for example. There are challenged areas geographically that have lower call volume that we know are historically challenged. So we've tried a couple of things in Renfrew County that are different than anywhere else, but the province is actually following our lead on them and have invested significant dollars across the province to follow our model, and I'll talk to you a bit about that. A couple of interesting things. You probably know each of these plots of land, especially within the Whitewater area. You can see that we have, the Twin Towers in Pembroke. You'd expect that based on population density. But you can also see in the Beachbrook area where we have a disproportionate amount of calls coming from the long-term care seniors facility there. So that's something that we need to and we have been addressing in a number of different ways, working with Dr. Levine, working with the staff, and we actually go in and see patients in that long-term care facility proactively to make sure that they have the support that they need so that 911 does not get called, and I'll show you the results of those efforts. You can also see that from the building just behind this one here in Cobden as a driver in terms of calls at the other seniors facility here in town. And then you'll see smatterings. You'll see Algonquin-Spickwalkinagon is a driver based upon the socioeconomics and so on. But those areas challenge us significantly because they're not directly adjacent to where our vehicles could be or should be at any given time, knowing the number of calls that we have for service. So what we did was we undertook with McMaster University a geographic information system analysis in terms of how we can best influence those populations that have a higher predictability of use based upon a frailty score and looking at not only the acuity in terms of emergencies, but also the predictability of loss of independence. So we undertook this. If you're into the data and you want to geek it out with me, I'm happy to chat with you about it afterwards. But there's a lot of science on the back end to look at every single call historically within the County of Renfrew, where it's coming from, why it's coming in, and how we can employ a different model to reduce the calls that we're getting. Said differently, we're trying to put ourselves out of business by keeping people stay healthy and get healthier so that they don't need our services, because we know as our aging population, similar to the conversation that was had in the previous committee regarding, what's going on with young people, we know that we've had an exodus of young people and the older people are staying behind. So not only are we getting older as a population, your demand for healthcare utilization increases exponentially, but you also have the younger people hanging around to be able to provide those supports to their parents and grandparents as they age. So that means it tips back over in terms of our service delivery. Not sure how I turn that on or off, but maybe that'll do it. There we go. So what did we do differently? There was discussion a number of years ago about building an ambulance base in Cobden and staffing it with an ambulance and 2 paramedics. There was discussion at County Council, respecting it was before many of the people sitting around this table's time. So I'll just give you a bit of the history, and we talked a little bit about it before, where it was decided at the time that we have 2 gaps in service. If you go back to this slide, you can see Whitewater is, not covered by those discs adequately, and I think we all agree upon that. Interestingly, those purple squares that are in there are showing call density based upon response type within that square kilometer that continue to add pressure. So it would be one thing if nobody lived there and there weren't calls, then kind of like Head Clare Mariah, for example. No disrespect to my friends there, but it's very difficult to justify an increase in service delivery to 200 people. Albeit recognizing that all it takes is one person to have a tragic event and a really long response time. But I can't, from an economic perspective, cover all of the county all of the time, perhaps to the degree that people think that it is. So we look at different strategies. So the 2 main areas was the Whitewater area through Admaston Bromley and then around on the Killaloe side, that we knew if we were going to sort of, put our next buck on the table in terms of better serving Renfrew County, how would we do that, and what would that look like? So we moved those standby ambulances preferentially to this area and to the others. We know that that's made a significant difference. We can measure ourselves in time, and we can also measure ourselves in survivability or comorbidity, mortality rates, and I can talk to you a bit about those. But what we did do was we said at the time we were going to try out putting a paramedic in a Ford Explorer type vehicle in those geographic areas for their shift, and we're going to do it such that they will do home visits, they will work with your community health center at Beachburg, they'll work with the family health teams, community health center at Killaloe, they will work with the schools, we'll put AEDs in your buildings, we will do mass CPR training in the community, we'll do helmet safety, we'll identify seniors, much like the research did in terms of who people are and how we can get to them before they need us, all in an effort to decrease our response. We started out in doing that with 2 units, you'll recall, where your municipality graciously gave us space downstairs for 2 paramedics to start and finish their day. And that worked quite well, and we had 2 paramedics in the facility, coming and going, and their productivity overall was low in relation to what we've been able to tap out of them to date, both on the emergency and non-emergency side. But we found some success, if you will, from the province in that both the federal government and the province gave us money to get more of these community paramedics on the road. So we grew overnight last spring from 2 to 5 in the county of Renfrew. In doing that, it created a number of pressures for us, which I'll talk to you in a moment. But it is what caused the shift in terms of our needing to consolidate our resources. And that occurred simultaneous to the province coming in and saying, you can't have a start-stop station without a garage. The Ambulance Act clearly says that you must have shelter for your vehicles so that the equipment in the back and the vehicles themselves are protected at all times, apart from when they're driving, obviously. That created some other issues for us, and previously I had spoken with Reeve Rathwell, it's a bit of a tongue twister, I'm sure you're used to, about, these were concerns for us on a go-forward basis, but we were trying to make it work as best we can. So I'll speak to that in a minute. So roll forward to this year, we now have done we do 12,000 emergency calls a year as a service. The 5 community paramedics that are now out there, like the 2 that used to start out of here, have now seen over 13,000 patients in the last year. So we're now doing more preventative work in the community than we are doing emergency calls, with considerably less resource in that it's only 5 people doing the work of 20 people on 10 ambulances, if you will. So there's a significant improvement to that. We've also been able to improve our response time so that when a community paramedic attaches to a call, as we call it, they've improved our response time as a whole by almost 15 minutes at the 90th percentile. And then lastly, we've received statistics from Bonnie Johnson at Beachburg. This is a direct benefit in terms of this community. We've been able to input their throughput. We've been able to improve their throughput of patients by almost 40% at that clinic. So because we're taking care of the people that they're most concerned about in the community and keeping them not only from calling 911, we're actually loosening up their waiting list so that they can move that many more of your residents through that clinic to the tune of 40%. We typically wrestle with, can we achieve 1% gain, 2% gain? Bonnie came back unsolicited and said, you've helped us move that bar by 40%. So this is what it used to look like when we had 2 units. So you had 2 vehicles parked out back, we had space in the basement, and we appreciate and continue to appreciate that space. But what then occurred was we went to 5. So each of these areas represents a zone in the county of Renfrew, and we struggled with a number of things. One is we didn't meet the provincial regulatory requirement for shelter for the vehicles. The second thing that occurred was that we now had 5 people that were intending to work together, and we needed to get them all in a room at 8 o'clock every morning, give them a 15-minute briefing, and then kick them out the door into their zones so that they could go and do the work to be able to achieve the 13,000 home visits that we did in the last year. Simultaneously, they run 16 wellness clinics, which are denoted here by the green crosses throughout the county that you may be familiar with, and we also supervise Heartwise exercise sites throughout the county with those folks. The Star at Deep River is a single paramedic who works in Deep River. It's funded by the LHIN to deal with the waiting list for long-term care. So the challenge you can see is that we went from 2 working out of the basement here to 5, and we needed to align vehicles, staff, administration, briefings for them to be able to do it effectively, and we chose to move them to Renfrew, where we could house them inside, give them a boardroom, and get them organized. The error on our part was that I didn't communicate that to your administration. I had had a chat previously with your Reeve saying, these are the challenges, this is where we're headed, respecting that may not have and probably didn't translate into the new knowledge of your new council, because this goes back to when we had originally received notice that the ministry may be funding us. So that's an error on our part in terms of not effectively communicating the change here. That being said, we have maintained the room downstairs. It is what we call a drop-in site for the community paramedics. to be able to use for administration, to be able to, you know, touch down and then go back out. Because I think it's important that you understand that if we have a paramedic sitting, you know, in an office downstairs, to us, that's not good. To you, it might feel good because you know that they're here and that they're present and you can see them. My job is to get them out in the community and get them out seeing people. So the effect of us pushing them out in the community, I don't want them at any base, I don't want them in any building per se, I want them out visiting patients. So when you look at this in terms of the overall responses, you can see for the time periods denoted below that the number of responses fluctuates month to month in Whitewater region, but also does our community paramedic responses. So you can see that we've been able to maintain about a 63% average. So 63% of the emergency calls that occur in Whitewater region over the same time period, we're able to get community paramedics also responding. And they are the highest trained paramedics that we have within Renfrew County. So not only are you getting an ambulance, but you're also getting a community paramedic response unit 63% of the time. The interesting thing on this chart, if you like numbers like I do, is that we've been able to overall decrease the number of emergency calls within this community, and this is mirrored now across the county in terms of the overall responses or requests for service that we're having. So the effect that we're having in the research that I showed you previously shows that by us getting to someone that we know is frail and vulnerable, you know, maybe it's somebody that you know in the community that we do these home visits for, we know that when we take somebody into our program for home visits, they're 80% less likely to call 911. And that's a huge success for us because it means that we get to keep the ambulances we have for those truly emergent calls while being able to affect that data. In Whitewater region specifically, when we had the two paramedics downstairs, this is the blue line, we were able to see about 165 people over that same period of time. In the 6 months post moving the two paramedics from downstairs to Renfrew, we've actually been able to see 365 clients in the Whitewater region at the same time. So this is where it becomes sort of inversely proportionate to what makes us feel good, which is if they're starting their day here, granted we know where they're starting their day, and you get to see them and you think it's good because they're here. The reality is by moving them and coordinating them out of Renfrew, we've been able to almost triple their services to your community. So there's a bit of a disproportionate, you know, rationalization in terms of what does that mean? What it means is we're more efficient by putting them all together in one place at the start of the day, pushing them out into your community, knowing that they are still doing emergency calls to the same proportion they did previously. But perhaps more importantly, that they're getting to your most vulnerable people and having a greater impact by doing it in a coordinated fashion. So when you look at that from a community by community perspective, so you know this is where it gets really close to home, what does that mean? So you can see in the 6 months prior to June 8th when we moved to Renfrew, to the 6 months post June 8th when we moved to Renfrew, that we are far more present in your community. Our productivity is far greater within the homes of your folks. From our perspective, that's a good thing. I would love to be able to start all 5 units out of Cobden, to have a garage, to have a boardroom, to be able to do it from here, because as Marcia and I have talked about many times in the past, Cobden really is the center of the county. It's a great location to start and then push people out from. But as you probably know, we took over the old Canadian Tire in Renfrew, so we have space to get all the vehicles inside, to give them their own office, to give them their own boardroom, to get their act together, have all their supplies. We have a mechanic on site, and we can cycle them in and out. That's the productivity marker of why it made sense to us, but we respect that there's been a knowledge gap in terms of the rationale, so that's why we're here. Some of the challenges, as I've said previously, is access to vehicles in stock. Just because we have 5 paramedics and 5 vehicles, typically that takes about 7, because you need them all on the road at the same time to be able to move them through for their required maintenance and so on. To be able to meet the requirement of the government, I need to find them shelter. And frankly, I think it's a ridiculous requirement, but we got our knuckles rapped last time they came to town. We need the space to be able to do it, and we'd love a more central location. Right now, the Renfrew is the best that we have. It is adjacent to your municipality, but I respect there are times at the start and the end of the day where they'll be traveling to do their shift change in Renfrew. To be clear, we also went from a 7 o'clock start to an 8 to 8 start because we knew that's when most of the calls occurred in the county. That first hour was really a lost hour when we were running it at 7 to 7. We also look at organize their work in geographic zones, and we've also been doing research. So for those of you that are into that, we have 3 randomized controlled trials currently going on to look at the utilization, what's our experience been, what's the patient's experience been. We've published in 4 journals internationally, and it's showing that it's making sense, and in many thanks to this municipality because this is where we got our start. So what's happening out there? Our goal is to improve outcomes. So response time is nice, but it doesn't actually tell you whether you've made a difference. It just, it's kind of like when you order a pizza. It's one thing if it shows up fast and tastes horrible. It's another thing that if it takes a little longer, but you actually get the level of care that you want, then you're satisfied at the end of the day. And that's been part of the balance that we have. We also run wound care clinics, and we work out of the Renfrew Victoria Hospital and see residents from this municipality because that's a service that's lacking in Renfrew County. We also do INR and point-of-care testing, so instead of going to the lab to get your blood checked to see if it's thin enough to pump around effectively, we now go for elderly people in the community. We do that test in their living room. If it's wonky, we'll adjust their medications or call their physician to make that change to their treatment plan. We do medication and management and compliance. We communicate across health disciplines to make sure your residents are getting the services they deserve, such as the CCAC. We also do a number of assessments, timed up and go, falls risk assessment. It's all written there. I'm sure there's any questions I can answer them for you. We also do immunization and flu shots, community referrals, and we've just launched a pilot program in ultrasound. So that we can do field-based ultrasounds and then take you to the right hospital the first time. An example of that is if you're in a car crash, we can actually look in your belly and see if anything's leaking. And if it's leaking, you're going to go straight to the trauma center. And if it's not leaking, we'll take you to a local hospital where they can give you, fix your bones and those types of things. But if you're really hurt, we can have a look inside you, see what's going on, and take you down the road quick. So this is our current status. We have federal research grant occurring. We have our Highway 60 North and South. We have provincial funding, both in HealthLink 10 and in the Killaloe to Barry's Bay area. The HealthLink has also started to give us some funding to reach into Pembroke because in years past I've said we're not going there. There's tons of service, there's adjacency, but we also have a population density where we can make a difference. So the province is now funding us through that HealthLink, and the Aging at Home program is our Deep River program. So what used to be sort of an ambulance service, wait for something bad to happen, call 911, and then we respond. We're trying to reach out in a different way. We're showing a reduction in response time to the community. Currently, your 90th percentile response time for the community paramedic response unit is 5 minutes and 26 seconds, and 9 minutes and 55 seconds on the front line, with an average of 4 minutes and 21 in this municipality. That being said, we always believe we can do better. 10 years ago, our cardiac arrest survival rate in Renfrew County was 1.3%. This past year, we now have the best cardiac arrest survival in all of Eastern Ontario at just shy of 14%. So whether it's front of life or back end of life, we would like to save everyone. We know that we can't, but to save the most people most of the time with the resources we have available, we've shown significant improvement. We know that there are one-offs, and there will always be one-offs, and we care deeply about the people who live in Renfrew County, but we also recognize that there are areas that are difficult to access, and we're happy to work with this municipality to do what we can to improve service. Madam Chair. There's our contact info. So my cell phone number, my email, Michelle, Brian, same. So you can call any of us anytime, 24/7, if you have a concern. And we're happy to come back, give you progress updates, or have a dialogue now with you regarding any suggestions you may have that we can better our service. And I can leave the slide deck behind for you if you like.
Thank you very much. We have any questions from Council? I'll just go to Council McLaughlin and then Marcia.
I sat here the last time, I think, Mike, you did this presentation, and I think we had a tragic incident in Whitewater region which brought that forward. Is our service, are we getting the same service? I know that the vehicles are not here anymore, which used to be here till 8 o'clock. This service, are they around our encatchment area, being Cobden, Beachburg, Westmeath? Are those trucks still, are those vehicles still being there as much as they were when they were here? And I understand why you've moved them. I can logically figure that one out.
Yeah.
That's my, as long as we were getting the same service, then
So, what the data's showing is that you're getting 3 times the service that you once were, when they were here, and that's a matter of productivity. So in terms of home visits and emergency responses, we're tracking in a downward slope in terms of the demand for service, which is, as the research shows, is directly proportional to our outreach and prevention. That being said, it's not going to stop motor vehicle collisions from happening and people having strokes and heart attacks and so on, but this care, the level of care that we're providing is ever increasing, and we know from a morbidity and mortality perspective, as well as a response time perspective, that Whitewater's not had as good a service at any time in the past. So overall, the data, the experience has been that the service has significantly improved from the advent of moving the standby vehicle and then creating the community paramedic response units, the 2, and now to the 5. The service has, if you look at it from a home visit perspective, you're getting triple the service you once were when the 2 paramedics were starting downstairs. And that's due to a number of factors. One is the administrative alignment. Productivity is up substantially within this municipality, and I measure our ability to serve you based upon their productivity and our outcomes. And both of those indicators are saying that the service is better than it ever has been, despite the fact they're not starting and stopping their day here versus in Renfrew.
One more question, Councillor McLaughlin.
okay, I'm just wondering, do you have the stats that we could see then, Mike? And that's, my main concern is that as long as we're getting this service the same as we were before, or even if you say if it's better, and I understand, and I totally agree with the, the preventive, that certainly preventive increases, the less calls, the better the service. That makes sense.
Yeah, so I'll leave the slide deck behind for you, because those graphs that I shared with you, if you take some time and have a look at them, they should answer that question, and if there's any more, I'm happy to dig through it. The response time data the province publishes on an annual basis, so we don't have the official numbers. That's why I wrote them down on a card here and didn't put it into the slide deck yet, but I'm happy to share that data with you as well. None of that excuses, and I think it's really important, Madam Chair, if I could, to highlight that any loss of life is tragic. When we're looking at it from a systems perspective, we try and again help most of the people as best we can, and we know that some people, no matter what we do, it's not going to make a difference, and others, there is a subset of the population that response time matters, as does the care that you provide when you get there. And overall, amongst your peer municipalities and other counties and cities, the paramedics that you have here are second to none, and the services that you're receiving are very good, but do not serve everybody in the amount of time it takes to make a difference sometimes. And there are circumstances where no matter what medicine you're bringing to that bedside, you're not gonna change the outcome, and there's a tragedy there, absolutely. But as administrators and political leaders, we try and keep most of the people happy most of the time. And when someone's not happy with our service, it's because something really bad has happened. And all of those are a tragedy and inexcusable, but they do happen. And I don't want to, sugarcoat that for this council or any other.
Thank you. Marcia?
Okay, well, it's nice to see you again. back in 2010, when I lost Curtis, you wanted me to call 911 again, and you fixed that. You helped that, so I appreciate that. And having you guys here, in the building here, in our community, prove that you've saved a numerous of lives in the Cobden area, which I thank you for that. Back when I did when you did your discussion to council, you said there was a legislative response time of 19 minutes. Okay, you guys got to Court in 26. So now you guys being out in Renfrew, what is response time for La Paz?
I don't have it with me. A couple of things have changed. The old legislative requirement of 19 minutes at the 90th percentile changed in 2013 from the province. So, but that, that's immaterial in terms of, what they require and what we try and achieve. But I will be happily provide you the response time by municipality and by community. We know that it's trending significantly to the better across Whitewater. And actually, when Michelle gave me these numbers, I almost didn't believe them, because this is substantially better than we've ever achieved in this municipality at any time in my 11 years here in the county. But that being said, we know that the La Paz area continues to be, challenged in terms of its geographic makeup. But we do know that more than ever, we have community paramedic response units in Whitewater available to respond to the La Paz area. So there is on one hand a reduction in the availability of service for the 15-30 minutes at the start and the end of shift, because they're not starting here and ending here. They're starting and ending in Renfrew. But at the same time, you have better coverage based upon their distribution throughout your municipality for the remaining 11 and a half hours of that shift.
Okay.
So without a doubt, starting and stopping here gives you more availability here, but it doesn't necessarily help your availability in La Paz.
Okay. So just having you guys here present in Cobden gave the municipality, gave the taxpayers a sense of being safe, that if something were to happen, that you guys were close by. Us not knowing that you had moved, it didn't sit well with any of us here or the people in the community. The reason why I asked for La Paz is because my other favorite man lives down there, which is my father. And on Monday morning, I got a frantic call from my mother that she was bringing him up due to his heart. And I said, call 911. And she said, no, they will not get to him in time, like they didn't get to Curtis. So that doesn't sit well. So yes, she did bring him up. He's still there. So what I'm wondering is I would like to I'd like for the township to feel comfortable, taxpayers to feel comfortable for the amount of taxes that they pay for the services of healthcare. Because when you need it, and if you've never needed it, thank God you never needed it, but when you do need 911, you want it there fast. And I don't think being in Renfrew, when you moved here, we were granted 12 hours a day, but we don't get that anymore by you being in Renfrew. And you can say we do, but we don't, because by the time you get to your office, or your staff get to their office, do their morning work, then go out around our area, but then go back and finish their paperwork, we don't have 12 hours given to us like we were supposed to. We only have, say, maybe 8. And when you're separating 8 hours to Haley's, to La Paz, to Beachburg, it's tough. So I would like personally see, and I hope council will feel that we do need something better. We weren't asked if we had a building that we could host one of your vehicles. I know you guys had it here, you plugged it in here, but we have a garage, we have a fire truck, maybe we could have, built something. We don't know that. It just never came up to us. So we did talk to Brian, Christine and I, and said that stuff like that should have come to us so that we could at least prepare council or the taxpayers as to what's going on. I'm not faulting you for that or nothing like that. I'm just saying that it's just too bad that we didn't know about it. And I just want you to clarify something, because I know when you guys came here, I promoted it to call 911 because they were closer now. And so does this still apply when you call 911 for the people in the Township of Whitewater Region? The 911 operator will tell you where the ambulance is. Is that still applying to us? Because at that point, we get to decide, because we're so vast, if we should be able to put our loved ones in a vehicle and take them.
Madam Chair, if I could.
Yes, please.
So they should.
Okay.
The Ministry of Health runs the dispatch center,
Okay.
as you probably know.
Mhm.
And it is a request that we've made to the province that all callers be able to receive an estimated time of arrival so that they can make best decision. And
Yeah.
there's lots of circumstances where it makes sense. There are other circumstances where it's improbable, impractical to move someone.
Yeah.
For lots of, medical or traumatic reasons. And there are other times where, we're also giving instruction over the phone so that the best care can be provided in those minutes, however many they may be, for our response.
Okay.
And as it relates to La Paz, we also now have a community paramedic response unit in Pembroke. So it would most probably be closest to respond to that area, if I understand the geography appropriately, that it may not even be the Cobden response unit that would go to that edge, that region within your municipality, because we now have those additional resources on the road. But you're absolutely correct that those first minutes of the day, there is a loss of readiness time based upon that adjacency, but by having sort of the distribution of resources that we have now, you're getting better service than you did before. But I acknowledge that because you don't see it, and we haven't explained it to you, that you may not believe it, but you'd rather them out there than here.
I just know that when they were here, the municipality felt very good, and the taxpayers felt like they were safe. So if you've provided us with the information, then I certainly trust you that the service is there, which is wonderful. So, thank you.
Okay, thank you.
And Madam Chair, I will say that we absolutely appreciate this, both staff and electeds, respect of the service that we provide, and that we want to make you feel safe as best we can. And part of that is about being seen and being aware, and part of that is getting out there and getting our job done. So we need to do a better job of balancing that. And apart from that one conversation I had with the Reeve, because at the time I said, do you have space for 5 units? And he said, no, maybe in Westmeath, because we have an operations garage coming available at the time, which I understand may be available, not necessarily in the right place overall, but that was the last and only conversation we had, and I didn't have it as a staff-to-staff level, so my apologies for that.
Okay, thank you very much. Due to time, we're going to take one more question from our mayor, please.
I was just wondering about patient transfer. Are we using our ambulances time and for patient transfer?
So a couple, yes, we are, but to the tune of 50% less than we were 10 years ago. So if you're referring to someone who has to go, from the long-term care to the hospital for a test, or to Renfrew for dialysis, or to the city for a specialist appointment, we used to do virtually all of that in the county, and we recognize that every time we do that, we're taking a resource away from the county. So we worked with the LHIN, who designated Care4 as the central coordinating body for all of Eastern Ontario, not just Renfrew County. That made a big dent, and we've been able to reduce the amount of time that we do these non-emerge transfers by over 50%, as I said. We also now work with Sunshine Coach, is that it, Brad? Sunshine Coach out of Renfrew, who we actually gave a very reasonable price one of our old ambulances, so they can do stretcher transfers for dialysis patients, for example. So we're working as best we can with the volunteer driver group. They've gone from doing something along the lines of 200 volunteer drives a year to about 5,000 in the last year, based upon the guidance and coordination from Care4 and the support that we've attempted to give them to make sure that the most appropriate service is being used. That's keeping us in the county more, that's keeping the ambulance at the flag more, that's keeping my guys out doing the community visits and the emergency responses. But I'll bring more data back as this council requests. I'd be happy to sit with Marcia and any of her family, and I'm happy to hear your dad's doing okay. I heard about the chat you had with Dave Libby yesterday, so that was good. And we'll keep you abreast. And Reeve Miller's been good to bring questions to County Council, and he's drilled me a couple times on this stuff, so I had an idea what was going on.
Very good. Okay. Well, thank you very much for your time on behalf of Mayor, myself, and all of Council. Appreciate you and your gentlemen coming out this afternoon. Very informative and greatly appreciated. Thank you very much.
Thank you.